Dr. Jeffrey Epstein of the Foundation for Hair Restoration with offices in South Florida and New York. Let's talk about hair transplant side effects. Much like any plastic surgery procedure, side effects can be reduced when it's performed properly. And the goal with a hair transplant procedure is to have it look natural and have good density with no evidence of any scarring. Obviously, there's some surgeons and surgical techniques that come closer to achieving those goals than others. Performed properly, a hair transplant should look and feel really undetectable. However, not performed properly, and also sometimes in certain patients for reasons beyond the control of the surgeon, there are less than perfect results that can occasionally happen. And some of those include poor growth or poor density, and that's usually due to improper handling of these very delicate micrografts. There can be some widening of the scar in the back of the head. Some patients just heal differently than others. In my experience is that over 90% of patients should have a donor site scar less than 2 millimeters wide. There is a relatively new technique called follicular unit extraction, which avoids the making of an incision. Instead, each graft is removed one at a time using a very tiny 0.8 millimeter punch. Other side effects can include the loss of existing hair. That's usually, once again, due to poor technique or over-aggressiveness, and then resulting trauma to the existing hairs can cause them to shed or fall out. And then also the appearance of the scalp where the hair transplants were placed can show signs, once again, if not properly performed, of a transplant having taken place.